Hello everyone, this is Dr. TSR. Today I am here to discuss with you something related to male partner infertility. Okay, so something related to male infertility. We all know the definition of infertility is the couple fails to conceive even after 1 year of unprotected intercourse, or if the age of the woman is more than 35 years, you will consider 6 months after the intercourse, right? So we always think about female and we will do all the female infertility investigation, but the first most investigation for infertility is semen analysis, right? So let us study today something in brief about male infertility. So when you take the history from the male, you take first is history taking. So what and all will ask whether there was any history of testicular trauma was there, or there was any history of mumps will cause mumps architis, so mumps is there, and any previous surgery sorry, any previous surgery is done for the testis, or there is any family history of cystic fibrosis. What is the coital frequency? Then is there any history of retrograde ejaculation or history of premature ejaculation? Is the partner is having diabetic mellitus, or is he suffering from tuberculosis, or any family history of male infertility is there? This all history you have to elicit from the male. Okay, and even the work regarding the work, whether any laptop use or radiation exposure, or is he smoker or alcoholic person, so all these things you will ask. So then when you come to the examination, so how much male infertility contributes? Male infertility contributes nearly about 30% of the infertility. So when you come to the examination, first thing is built. Okay, built means that BMI you check. Then you check for arm span to the height ratio. So that is mainly for Klinefelter syndrome. The arm span to height ratio is more than 1 in case of Klinefelter. So you will check for that. Then you check for whether there is any gynecomastia. Okay, then any scars of previous surgeries, there scars of surgeries are there. Then when you check the penis, whether there is a micro penis, or there is any epispadiasis or hypospadiasis. Then any penile ulcer is there, that rules out multiple sexual intercourse or not. Then you palpate the testis in the scrotum, whether it is small testis or not. Then you palpate the vas difference, whether vas difference is present or absent, and even you check for varicocele. Then if there is any cyst like structure in the epididymis, so you check for epididymal cyst or epididymal dilatation. Then if prostate is palpable, prostate cyst in with any midline swelling, like do you do PR and you check for whether any prostate swelling is there or not. So this is in brief key. You will take the history and you will check for the examination. So what are the causes for male infertility? When you come across the causes for male infertility, it can be congenital, like congenital bilateral absence of vas difference, or it can be Klinefelter syndrome, or it can be Y chromosome microdeletion, or Kallmann syndrome. So when it comes with acquired, so acquired is either it can be because of trauma, testicular trauma, or torsion of the testis, or there can be varicocele. Then erectile dysfunction, I told premature retrograde ejaculation, so erectile dysfunction, or it can be even some post inflammation, like my mum's, I told mum's architis. Then post inflammation, or there is exposure of radiation, irradiation. So these are the some of the acquired causes. Some idiopathic causes are something like smoking, alcohol, or obesity, use of recreational drugs, or toxin exposure to the sperm. These are the some of the causes for male infertility. So when I told the first most and basic investigation we will do is semen analysis. So here I am with the 2021 semen analysis, that is, so normal semen volume is 1.4 ml, serum sperm concentration is 16 million, 16 into 10 to the power of 6 million per ml. Total sperm ejaculate is 39 million should be there per ejaculate. Then total motility is 42% total motility, whereas progressive motility is 30% progressive motility. Then non-progressive motility is only 1% should be there, and 54% should be viable, that is vitality 54%. Then the morphology, at least 4% should have normal morphology. This is in brief about 2021 semen analysis. Okay, here I am with male infertility. It contributes to 30%. The best most investigation is semen analysis. So 1 year of unprotected intercourse, or more than 35 years for 6 months. So history you will take, you will do examination, and you know what are the causes, and you know what is the normal semen analysis. Okay, so this is in brief about male. Subscribe to my channel for more such videos. Like,